A biopsy is a procedure to sample tissue for diagnostic purposes. In the area of cancer or suspected cancer, it means to sample a mass or piece of tissue to find out what it is, and in some cases to do sophisticated tests to try to predict its behavior. We also do biopsies in the course of treating a disease in order to see how a patient is responding to treatment or whether some infectious or other process has developed. From a biopsy, we can learn whether a patient has cancer or what type of cancer he has. We can obtain information that might help to predict the course of that disease. We might find out how well the cancer has responded to treatment. In some cases, we can use a biopsy to determine whether there is an infection or some other process that has developed during the course of treatment of the cancer. There are many different types of biopsies that we use depending upon the circumstance. Biopsies are handled very carefully because we want to get as much information as we can from the patient who is going through the trouble of having a biopsy done. The biopsies are passed to a laboratory technician, and in some cases they are spread out onto a microscope slide or frozen immediately for rapid processing. Biopsies are analyzed initially by the pathologist who receives the sample. Depending upon the tissue and the situation, the clinician will also be involved in interpreting the results of the biopsy. Different biopsies take different lengths of time. There is the question of the initial processing and also the information that is derived from it. Different biopsies are subjected to different techniques. In some cases, it's just a question of fixing the tissue and slicing it to look under the microscope. In other cases, it involves staining the microscope slides with various chemicals to determine what types of cells are present. In other cases, we use techniques in the laboratory that will identify cells by the proteins displayed on the cell surfaces. For most biopsies, the patients are put to sleep for the procedure so that they are not uncomfortable. Some biopsies are performed in the operating room by a surgeon with anesthesiologists. For some procedures, including most of the bone marrow biopsies that we do, the patients are put to sleep in a special sedation area outside of the operating room. When biopsies are done in the operating room, there is usually an assortment of people present, including an anesthesiologist or nurse anesthetist, a surgeon, a surgical assistant, and a variety of nurses. When biopsies are performed in a sedation suite, then it's generally limited to an anesthesiologist or other individual whose responsibility it is to sedate the patient, a physician who is performing the biopsy, and at least one nurse is present to handle the patient. We also often have a laboratory technician present to handle the sample immediately. In some cases, the parents stay. Incision sites for biopsies are handled the way they are for any other operation. After a bone marrow, the incision is very small and usually just gets a Band-Aid. There are risks associated with any procedure that's done in the hospital, just as there are risks associated with crossing the street. So we have to decide whether the risks of any procedure are worth the information that we would get from it. In the case of a bone marrow aspiration, the risks are very minimal. After the procedure is over and the anesthetic wears off, there may be some discomfort. Generally, these patients can be managed either with oral or injection medications depending upon the procedure that was done. Biopsy procedure may take a long period of time if the surgeon has to find his way to the target tissue and avoid normal structures. For a bone marrow aspiration and biopsy, generally the procedure only takes a few minutes.
For a biopsy procedure, child life can be very beneficial in many ways. We can provide preparation on a child's developmental level to help them understand the process of everything that's going to go on. We can work with parents if they may prefer to prepare their child themselves. We can use a lot of outside resources such as different applications on the iPad. We use a lot of hands-on teaching tools, a lot of medical equipment to help familiarize children with what they're going to see. I would recommend for parents to speak with children open and honestly when they're going to have a biopsy scheduled. Studies have shown that children respond best and are able to cope in a more positive way if they have open and honest communication about what's going on.